Hi, I'm Ryan Fix, CEO of Arevo Health. I want to give you a quick demo of our platform, but before anybody who doesn't know or hasn't read, Arevo Health is an enterprise SaaS company specifically designed for self-funded employer healthcare industry. The platform is vendor agnostic and provides unbiased reporting for companies to better really manage their healthcare benefits. The platform includes data warehousing, real-time financial reports, vendor performance management tools, and complete ROI tracking of plans and programs. So as health plans in the US, we've got about 26,000 companies that self-funded their benefits. That makes up about $750 billion spent annually. What they're trying to do is drive down healthcare costs, and while most organizations are trying to solve it at the member level or the employee level of how they consume their healthcare, we think the root cause starts internally with how companies really design initiatives and so forth. So if they're investing into telehealth or new prescription benefits managers, population health companies, direct primary care, or so forth, we're looking at do those investments actually yield results for the plan. And so this gives you a glimpse of what the dashboard looks like for a company as they land. It gives them member information and kind of how the plan is performing financially at a high level. We'll talk about our plan and engagement savings opportunities where we're using AI to analyze the claims data at the individual claims level and look for opportunities for savings. And then the plan performance metrics here in the middle really gives an idea of year over year how you're trending with the plan. We're breaking it down at the plan level. We're looking at cost share between employees and employer. And we're also looking at the vendor performance. So, are your payers being able to pay your bills on time and so forth, and kind of what the stop loss premium looks like as well. As we jump down here, we're looking at the ability to break these down and categorize into spend buckets, customizable by company. And then we get into member performance and so forth, and looking at different reports. This shows your compliance percentage as it relates to preventative health. We've got claims distribution. All of these things are being able to dive into to see what's going on. But what we've done is protected companies. There's no PHI that is presented back to the company. So you can't be able to drill down to find that out, but you're being able to really start looking and analyzing your data to figure out what's driving some of these things. So you've got top claimants report, claims by age, you have top providers, prescription drugs, and then all of these reports are also historical. So how many years of data you have in the system, which is really great for companies to be able to see what's going on. They're able to dive in. So if you've got the finance team wants to really understand what's going on and look at some of the trends, you have complete detail and breakdown by your population and your spend by category. So here is premium funding detail. We get into the stop loss and being able to look at that and look at claims that are penetrating your stop loss. Your IBNR report, the red is actually what we're backing out that are stop loss incidents, and being able to look at your true net runoff for your IBNR, which is really your tail of exposure. True cost report, which we talked about. And again, these are by year, so you're able to kind of come in and see what your prior years were as well. And if you come into the opportunity side, this is where we're using AI. And the green here talks about plan design savings. We're looking at opportunities where you potentially could look at being able to drive down costs by looking at different vendors. So maybe a telehealth initiative works for your plan. Maybe it doesn't. Maybe you're investing into wellness, and we're able to be able to monitor and look at the benefit of those over time, and looking at the gross spend versus your savings and really the net impact on the plan. And then at the individual level as well, we have an ability to see how members are consuming healthcare and allow for education back to be able to migrate people to the best places based on cost, quality, and outcomes. And so you've got the ability to dive into any of these, see the total population, look at who's going where based on the age range, and then what they paid in the marketplace for their pricing. So this is just giving you a taste high level of really what the plan really gives based off this raw claims data feed that they're getting on a monthly basis. Here's another interesting report is a lot of companies, as you go self-funding, your own insurance company, and there's not an easy way to find out, how much of your spend was actually truly going towards healthcare costs versus administration, insurance, and so forth. So we break out all the services a self-funded organization would want and need, and then also all the vendors that are receiving the compensation, to be able to pull that out, to be able to evaluate what's going on and be able to incentivize those vendors to help drive down and align their incentives and their compensation to the performance of the plan itself. So this just gives you a high level of really the Arevo tool, and hopefully you're able to get a taste of what we can do for self-funded plans.